Linda, and this is Joe. We're pharmacists at Twin City Pharmacy, and we both graduated from the Rutgers Pharmacy program right here in Jersey.
We're here to talk a little bit about what a pharmacist does and what we do day to day, and go over the most common questions, what we hear about the coronavirus.
Okay, so let's start. When you get a pharmacist degree, there are a lot of fields that you can go into, like industry, marketing, research, academics, and retail, which is what we decided on. Community pharmacists like us are the most visible pharmacists because we interact with the public, and many people call us about questions instead of making appointments to see their doctor, because we are way more accessible and our advice is free.
Twin City Pharmacy is pretty special because we're an independent pharmacy. We really needed to find a niche to be able to compete with the big box stores like Walgreens and CVS. So not only do we provide medications to your families, we also compound medications in different forms, like if you can't swallow pills.
Or medications for your pets.
Right. So on the retail side, we do more than just dispensing medications. We review the medications that our customers are taking and help them better understand about how they work, why they need to take them, their possible side effects, drug interactions, and when the medication will take effect.
So when you take antibiotics for strep throat, we let you know that you'll probably start to feel better by the second day. Certain antibiotics decrease the effects of birth control. Sometimes they can cause upset stomach, so you got to take it with food. On the other hand, your parents or grandparents, they may be taking blood pressure medications, diabetes medications, and they may never feel the effects of these medications because unlike medications that treat infections, these are preventative medications. So it's hard to see the effects. So we teach them how the medications work and how it'll prevent things like heart attacks and strokes down the line.
That's why it's important that you fill out one pharmacy so that we as pharmacists can get a whole picture of everything that you're taking.
Also, this way we can help you pick the best insurance plans for you. Most of you will probably get your insurance plans through your jobs and probably not even use it for a while. But for your parents or grandparents who have Medicare, we use their profile of medications to help them pick the best insurance plans. I mean, it's really hard to navigate our healthcare system as it is. So imagine not knowing how to use a computer and then trying to figure out how to choose between 60 health plans online and then signing up and then, having the plans contact you once you sign up. It's crazy.
Yeah, it's a real doozy. And then the part that you don't see from our day to day, it's actually one of the biggest parts. We provide comfort medications to people who are terminally ill. It's called hospice care. Hospice means that a patient isn't likely to live longer than 6 months, and they're choosing to spend their time at home with their loved ones rather than spending it in the hospital towards the end. And we deliver medications all throughout the state for that.
So as you can imagine, these patients, they have terminal diseases. They're usually in a lot of pain, have a lot of anxiety about end of life. So not only do we send out the medications to alleviate their symptoms, we will also provide oxygen if they have trouble breathing, electric beds to help the caregivers move the patient, and then we'll work with the doctors and the nurses to provide a comprehensive care plan.
In addition, we provide incontinence supplies like adult diapers and bed pads because the patient can't get out of bed and they don't have as much control. And we also supply wound care supplies because if they're in bed all day, they can develop sores and ulcers. We discuss with doctors and nurses the best kind of treatments to use for that, whether it's an oozing, crusting, or tunneling wound, you name it. We take the time to consider all the different aspects and to provide better care for the patients and their families.
Yeah, so all in all at Twin City, you can tell there's like a lot more things than we do than retail chains like CVS or Walgreens, and I wouldn't be exposed to all of these things if I had worked there. So working here at Twin City, I kind of feel like I'm learning a lot more and I'm making a difference in people's lives.
Now on to the coronavirus. If you haven't been living under a rock, you've probably been barraged by a ton of information about it. COVID-19 has affected millions of people around the world, killing almost 300,000 people. And when they're talking about flattening the curve for coronavirus, they're making sure that not everyone is getting sick at the same time, so it doesn't overwhelm the healthcare system like it did in Italy a couple months ago. Just trying to drag everything out a little bit longer.
Right. So you guys probably all already know the symptoms, but it's hard to tell if you have COVID now, especially because of allergies. The symptoms are very similar. with the trouble breathing, the wheezing, shortness of breath, cough. I mean, it's similar to the cold and the flu as well. If you have the fever, the chills, shaking, muscle pain, headache, sore throat, um, fatigue, and you just generally feel like crap. Um, there is one that's the loss of taste or smell that is pretty novel to this. You may only experience one of these and have a very mild form of the disease. Regardless, it's important to get tested as soon as you develop symptoms because you're protecting other people around you. So while you may overcome the disease with relative ease, someone who comes into contact with you may not be so lucky. So if you test positive, obviously you're going to self quarantine, but it's also important to trace where you've been so that anyone who's been in contact with you can get tested as well.
Luckily, the closest testing center is right here in South Plainfield at AFC Urgent Care. For a more complete list of information and testing sites throughout the state, go to covid19.nj.gov. So right now, researchers are in a rush to develop a vaccine for COVID-19. Vaccines are normally dead or inactivated viruses that are injected into the body to help the body create antibodies to create an immune response for when you're actually exposed to the real virus. Pharmacists are on the front lines to provide vaccines to the community, but until we do get a vaccine developed, here's a list of safety measures for what you can do when you do go out.
Okay, so even when we're not experiencing a pandemic, it's important to practice good hygiene. Hopefully, you've all been washing your hands. What I'm going to go over is called cross-contamination. And this can happen really easily. Say you go to the supermarket and you're wearing your mask, you're wearing your gloves, and you go into the grocery store, you're touching everything. So, you go pay to check out, grab your phone, whatever. And then you get in your car, you take your gloves off, and then you go put on your playlist. And now your phone, which was contaminated in the store if you took it out, is now touching your bare hands. So this is like a thing that a lot of people don't realize. They wear gloves in the store and then they still touch their face, they touch their hand with their gloves. So it really doesn't make any sense to even wear them at that point. Another thing is masks touching the outside of your masks. So when you put on a mask, you should just be touching here, sliding it on. Pull this under your chin and flatten this against your face. And that should be the last time that you touch your mask for the duration of you wearing it. Don't be nudging it up and down. I know from experience at work that when you're talking, your mask moves up and down and might go under your nose or something like this. This is not proper mask wearing. Like, this is not going to help you. This is not going to help you. This does not protect anything. So you want to make sure it's over your nose and under your chin. Masks are really to protect other people from you. Say you sneeze or cough, it catches your droplets before it becomes aerosolized all over the place. There is a static film in here, so you don't want to wipe this down, like drench it or wash it. That'll kind of get rid of how it works. Then when you take it off, you're gonna take it off like this. If you plan on keeping it, you can hang it up in your rearview mirror or something like that. Don't touch this side and then touch yourself again. Once you take it off, you want to hand sanitize again, sanitize your phone. And if you want to put this somewhere, like if you need to store it, paper bag, not plastic bag, because that will help let the moisture that's been on the inside and the outside, and like neither side are very clean because it's your mouth on the inside. It'll help absorb all that moisture that's been building up this whole time. And then if you hang it in your window, the sun rays, the UV rays will help sanitize it. You do have to leave it overnight. The best thing is maybe a couple of days to let it before you wear that mask again. And so when hand washing is not readily accessible, make sure you have hand sanitizer with you all the time and alcohol wipes in your car so that you can sanitize your phone and your hands as soon as you get in the car. Because even, like you come in from the supermarket, the cart that you're touching, the grocery bags, everything, you're going to wipe those down again or not. but you just want to make sure, because the phone is touching your face all the time, touching your hands. So you want to make sure that those are wiped down. Like my phone has handprints all over it, and it's already been wiped down multiple times since I got home. So wipe down surfaces like doorknobs, everything like that. Do not forget your cell phone. Most important.
Right. And we hope you found this video informative, and feel free to give us a call if you have any questions. Bye.
Bye.